My name's Tracy and I'm 45 years old. I had a melanoma on the inside of my left ankle. Unfortunately, it had been there for at least 3 years before it was treated. So it had grown to about 3 centimetres in diameter. And it was in a very awkward place. It wasn't quite on the undersurface of my foot, and it wasn't quite on the side, but it was kind of on the corner between the two. I am a large animal vet. I work pretty much 100% with dairy cows. I've got 3 boys. They like biking, climbing, swimming, surfing. We like all the physical stuff. And my wound just stopped me doing everything.
At the very early stages, Tracy had a wound that had a low-grade infection, and also she had a wet, oozy wound. With Tracy's wound, we had to find a dressing that was conformable, comfortable for her, easy to apply and easy to remove, but also that stayed in place. So we then decided to try the UrgoTul Absorb border dressing, which has TLC technology, which encourages new fibroblasts to come into the wound, also helps to build and strengthen the extracellular matrix, which is part of the new granulation tissue in the wound. And also we wanted a dressing that would help to just support the contour of the wound, which the UrgoTul Absorb border did.
I think we began using that on my wound about a month, 5 weeks post-op. It just felt like it moulded to the shape of my foot, and it just felt flexible, really. I think that's the biggest thing I would say.
If it didn't go down into the right place at the first time, you could just peel the dressing back and then just place it down again, and it stuck as well as if you were placing it down on the first time of asking. The other benefit was that it did actually encourage the wound to heal, and also it was very comfortable for the patient. She felt it created a little buffer between her skin and the outside world.
3 to 4 days later, when I had the dressing change, it really had improved such a lot, and I could tell just by looking at it that it wasn't so moist. It just really picked me up mentally. We used UrgoClean in the latter part of my wound healing, and in fact I've only just stopped using it now, which is 5 months post-op. For me, the protective part of it was the best, in that it's slightly cushioned, and I felt that that was protecting my wound. It's reasonably adherent, but I felt when I took it off, it wasn't disrupting the wound in any way, it was keeping it safe. And so a big plus was the fact that I could go back to work, and as I say, that happened at 13 weeks. Also now I'm starting to be able to do a few exercise classes again. I can go and take my boys on their bikes. I can, go back to normal living.
When we look at Tracy's experience, she has used the whole range, and for her that was really beneficial because she had a lot of confidence, and for her certainly the fact that we had something else to offer was really positive.
I think the fact that I've got these products in the bag, literally in my medicine bag, means that I can think, well, that's okay. If I do that wrong, I've got this product to use, and if I do that wrong, I've got this product. So it's kind of like a backup for me mentally as well. So yeah, I was really happy with the Urgo products.